Hey Mama! Hello, welcome to this video. In this video I'm 33 weeks pregnant and we're going to talk about the development of baby as well as mama symptoms, how you can alleviate some of those symptoms, help yourself further in this third trimester and feel good up to the very end and giving labor. Let's talk about the baby first. So the baby is around 44 centimeters long in week 33 and weighs around 2 to 2.10 kilograms and is the size of a pineapple. Hence I'm wearing this lovely pineapple outfit today. Let's see what's happening with baby. There's a lot of brain growth and brain development. Those grooves and folds are getting more complex and there's more and more of them. And this allows for more neural connections to also be formed. The baby now has sleep cycles. So the baby has a light sleep and a deep sleep and also REM sleep. So this rapid eye movement cycle in sleep, which means that your baby could be already dreaming about coming into this world. The lungs are still maturing, so they're not quite yet 100% ready to breathe in the outside world, but if your baby were to be born today with a little bit of assistance, they might be able to already start breathing by themselves. Fat layers are building up under the skin of baby. The bones are hardening. Apart from the bones in the skull, these remain soft and they can move around, as these will be squished and moved if you have vaginal birth, and the baby will be coming through the birth canal, so the baby can fit there. Around this time, many babies will already be head down. So I know that mine is. I went for a checkup a few days ago and my baby is already head down. If your baby isn't yet, then there still is space to move, to flip. So your baby is upside down and is with the head down. So this happens to most babies around this time, if not earlier. Then by week 33, 34, your baby will be head down. Hiccups are common, and in my first pregnancy I remember that my baby was having hiccups very, very often, and the gynecologist said that this is a good sign that they are practicing breathing. It's one of those motions to practice breathing. This one, I think, only had hiccups once. So I hope all is going well. No, everything is going well, just not the hiccupy type. And if your baby were to be born in week 33, they will be considered moderately preterm. In most developed countries, they have a very high chance of survival. Around 98% of babies born now will survive. This is amazing news. So that's it when it comes to our baby pineapples. Let's have a chat about us mamas. So breathing and circulation, this is getting harder because the uterus is pressing on the diaphragm and there's less space for you to take a nice deep breath. So this will indeed be getting harder and you'll be experiencing shortness of breath. And when it comes to circulation, your heart, you might feel that even, that your heart rate is higher and faster. And that's because your body is circulating 40 to 50% more blood volume than it did before pregnancy. You could be experiencing more and more pelvic pressure because the baby, well, A, is growing, the uterus is also still continuously growing and pressing down here on the pelvis area. And also because your baby will start kind of shifting slowly downwards. So you could be experiencing this pelvic pressure because of that. What is recommended for strengthening the pelvic muscles are Kegels. do Kegels daily. I have 2 videos about Kegels, one explaining why they're important and how to do them, and one with just 6 minutes of Kegel exercises. I will link them, so do Kegels daily. This is very important to strengthen those muscles for birth preparation as well as for postpartum recovery. You could be experiencing lower back and hip pain. So this could be pain in the ligaments also because of the hormone relaxin that is being produced during pregnancy. This hormone helps to relax the ligaments, but therefore it is very important to strengthen the muscles, so there is something supporting those bones and ligaments. So that's why exercising and body strengthening in pregnancy is so important. But also, of course, you need to prepare the body for birth itself. So also stretching exercises and opening hip and pelvis exercises are important as well. So if you do a combination of those 2, then you will be well prepared. Join me in my videos. I have a lot of these different exercises to essentially prepare you, mama, and your body for the rest of the pregnancy, as well as then to give birth. You could be sleeping worse for various reasons. There is more light sleep in this 3rd trimester. You could be going to the toilet more often because your bladder is being pushed and pressed. You might be having vivid dreams. Sleeping is simply uncomfortable, let's face it. So to make it as comfortable as possible, use a pregnancy pillow. I have a video about that as well, which pillow is the best, how to use it, and sleep on your left side to have optimal circulation, blood circulation. You could see various skin changes as well. So if you hadn't had stretch marks, they might be appearing now because your body is still expanding and stretching. That's around the breasts and around the hips. Some people will not have stretch marks at all, and this is due to genetics mostly, really. You might also be seeing this line down the middle of your belly, and it's called the linea negra. So it is a darker line that leads all the way up here. I now have that. It's a funny line because it's not exactly straight. It goes on the left side on the bottom and then turns kind of around the belly button and goes on the right side. So it looks quite peculiar, but this is completely normal. So let's see what other tips we have. Nutrition is key and hydration is key. So eat a variety of meals high in iron, high in protein, high in calcium. Supplement your vitamins as well, because we cannot get everything from the food that we eat. My appetite personally has gone down slightly, so I don't feel like eating so much anymore. In the 2nd trimester it was massive, and I could also experience massive growth then in baby, in belly. Now I don't have to eat that much and that often, so it has slightly changed. But it is important what you eat, as well as taking those vitamins and supplements. Another thing that is very important now in the 3rd trimester, and especially in these last weeks leading up to birth, is mental and emotional preparation. If you don't have one yet, think about a birth plan. What is your option A, B, C? You would like to have birth in a certain way, and these are your priorities during labor. Talk to your partner about it as well. Talk to them about the roles that you and he or she will have during this process. That is very important to talk about that, as well as prepare a printed out birth plan that you can give to your doctor or midwife when you go into labor. So you just put that in your hospital bag that you will take with you, and maybe this can be one of the things that your partner will do. Give that birth plan to the doctor or midwife so they can follow your preferences. Practicing deep breathing is very important in these last weeks leading up to birth, and I will include more breathing exercises in the workout exercises. Meditation could be beneficial. Hypnobirthing is something that is super nice. And I have a video where I talk about hypnobirthing to a hypnobirthing specialist. So I'll also link that video below so you can have a look at that one. Using reassuring affirmations is key for some people, as well as calming music. So all of these things you can already look into, talk about, find, practice in these final weeks leading up to birth. Week 33, 7 weeks to go, plus minus. We're in this together. For now, we'll continue training. Thank you for joining me in this video, and I hope to see you in another video where we can continue strengthening and moving our bodies. See you soon. Bye.